This is instruction for how to apply gentle pressure to the spine. This is helpful if you are massaging a loved one. So I would have them lie face down on the table. We'll use this sandbag to represent their back. So this is the back of their spine. They're actually lying face down like this. I'm going to come to the side of them and I'll put my hands in this cross position, and I'm going to be using the squishy part of my hands right here at the base of the palm. I'm going to find the spine, the bony part, and I'm going to put my hands on the other sides of that. So I'll be right along the bony part of the spine, and I'm going to lock out my elbows, and I'm just going to bring my shoulders over the top and let gravity sink my weight into their back. Now you need to ask, how does this pressure feel? If it's too much, lift up and release the pressure. Now you can go with their breathing. So as they inhale, you're going to come up, and then as they exhale, you can let your weight sink into it a little bit more. And then when they breathe in, you'll kind of let the pressure off a little bit so that they can actually bring that air in, and then you'll let your weight sink back down. Very rarely am I actually pushing into someone. Usually all I'm doing is locking out my elbows, leaning over the top, and letting gravity push my body weight into them. And then as they breathe out, I go a little deeper, and as they breathe back in, I let some pressure off so that they can actually bring the air back in. So I'm just kind of moving with their breath. If I need to apply a little bit more pressure, a lot of times all I'm going to do is make sure my shoulders are right over the top and let gravity apply that force. If you still need a little bit of pressure, you can push by just dropping the shoulders into it a little bit, but you don't need to thrust, you don't need to press hard. But since you can't see this person's face because they're face down, you need to constantly be asking them, how does this feel? You don't want to push too hard. You're not trying to actually crack or pop anything. If it happens inadvertently, don't worry about it. You're just trying to provide some overpressure and a little bit of soft tissue work and joint mobilization with light pressure. This should just be used as a gentle massage or mobilization technique, and it should be guided by the person on the table. So it should feel good. And if it doesn't feel good and it's causing pain, you should definitely stop and go seek some professional help.